Nice to see you all. What a nice welcome. Thank you all so much. There must be an election coming, right? Because people are fired up. Thank you all so much for being here, and thank you to the New Hampshire Technical Institute for hosting us this afternoon. I know that you join me in being so excited to welcome back President Joe Biden to New Hampshire. I know we can't wait to hear from him. I want to thank Lauren, who is going to share her story, and we will hear from her very soon. The President brought us together today to really discuss a critical issue to Granite Staters in the country, and that is the skyrocketing cost of prescription drugs. Now, some of you may know that that's a particular issue for our family because my granddaughter, Ellie, was diagnosed with type 1 diabetes shortly after her 8th birthday. Her mother, Stephanie, is here with me this afternoon, and of course, grandfather Billy, my husband Billy, is here as well. And we've all seen firsthand the challenges that Ellie and her family, Stephanie, her husband Craig, face trying to control diabetes at such a young age. And you know, our family has resources. We've had health insurance. They know how to manipulate, not to manipulate, to work through the system. Would that we could manipulate the system, right? But Ellie and millions of other Americans rely on daily insulin, and without it, they would die. The sad truth is that it is corporate greed that has made insulin unaffordable, that's pushed it out of reach for millions of families. Too many are forced to choose between putting food on the table and paying for the medications that they need to survive. And in the wealthiest nation on earth, Americans and our fellow Granite Staters should never have to make these kinds of life and death decisions. Insulin, like all prescription drugs, should be affordable and accessible to everyone who needs them. That's why I'm very proud of what the Biden-Harris administration has done in the last 3.5 years, why I'm proud to have been part of some of those legislative decisions. President Biden and Vice President Harris have overseen comprehensive, historic reforms to lower the price of prescription drugs, a massive leap toward ensuring that all Americans can get the medications that they need. And we've capped insulin at $35 a month for Medicare beneficiaries. But now it's time we cap insulin for everybody who needs it. Cap the cost. And for the first time in our history, the United States is negotiating the price of high-cost prescription drugs. And that means lower costs at the pharmacy, not just for seniors, but for all patients who need life-saving prescriptions. The President and Congress also capped out-of-pocket drug costs for Medicare beneficiaries. In fact, just this morning, a new report showed that patients have and will continue to save billions on their costs of prescription drugs because of this policy. But of course, we know there's still more to do. It's past time, as I said, that we cap the cost of insulin for all Americans, and Senator Sanders is here from Vermont with us this afternoon. So we want to ask him to take up my bipartisan Insulin Act, right? And we have to keep health insurance affordable for low and middle income families, which means extending vital ACA tax credits that keep premiums low for families. We need to negotiate the price of more drugs to keep your hard-earned dollars in your pockets. I know the President agrees with this. In a few minutes, he's going to tell us all how he's going to keep fighting for families and lowering the cost for every American. I know we all look forward to hearing what he has to say and what he's going to continue to do for the remainder of his administration and once he leaves office. So thank you all again very much for your attention.